Question 1. Quality control measures reveal that a technician may have inadvertently used an expired excipient during the compounding of a non-sterile oral suspension. The technician is unsure if the excipient was used in the entire batch or only a portion. What is the most appropriate immediate course of action for the pharmacy technician? Option A. Proceed with dispensing the suspension after visually inspecting the final product for any obvious abnormalities. Option B. Discard the entire batch of the non-sterile oral suspension without further investigation to avoid any potential risk. Option C. Immediately quarantine the entire batch of the non-sterile oral suspension and notify the supervising pharmacist to initiate an investigation. Option D. Attempt to identify and remove any potential expired excipient from the already compounded suspension before dispensing. The correct answer is C. Immediately quarantine the entire batch of the non-sterile oral suspension and notify the supervising pharmacist to initiate an investigation. Explanation. This scenario presents a common challenge in pharmacy practice, ensuring the integrity and accuracy of compounded medications while adhering to strict regulatory standards. The professional challenge lies in identifying and rectifying a deviation from established compounding procedures that could compromise patient safety and medication efficacy. Careful judgment is required to determine the appropriate course of action, balancing the need for immediate correction with the importance of thorough documentation and investigation. The correct approach involves immediately quarantining the affected batch of medication and initiating a thorough investigation. This aligns with USB 795, Pharmaceutical Compounding Non-Sterile Preparations, and USP 797, Pharmaceutical Compounding Sterile Preparations, which mandate that compounding personnel must be proficient in compounding procedures and that all compounded preparations must meet quality standards. Quarantining prevents the release of potentially substandard medication to patients, thereby safeguarding public health. The subsequent investigation, involving review of the compounding log, ingredient verification, and equipment checks, is crucial for identifying the root cause of the deviation and implementing corrective actions to prevent recurrence. This systematic approach is ethically sound, prioritizing patient safety above all else, and is a fundamental requirement of good pharmacy practice. An incorrect approach would be to proceed with dispensing the medication after a cursory visual check. This fails to address the underlying issue and risks dispensing a product that may not be potent, pure, or of the correct strength, violating USB standards and potentially harming the patient. Another incorrect approach is to simply discard the batch without investigation. While it removes the compromised product, it misses a critical opportunity to learn from the error, identify systemic issues, and improve future compounding practices, which is a core tenet of continuous quality improvement in pharmacy. Finally, attempting to fix the existing batch without a proper investigation or recompounding according to established procedures is also unacceptable. This could lead to further contamination or inaccurate dosing and bypasses the necessary quality assurance steps. Professionals should approach such situations by first prioritizing patient safety through immediate containment of the suspect product. Then, a systematic investigation should be launched, following established protocols for error reporting and root cause analysis. This process should involve reviewing all relevant documentation, consulting with supervisors or pharmacists, and implementing corrective and preventative actions, CAPA, as identified. This methodical decision-making process ensures that errors are addressed comprehensively, leading to improved patient care and adherence to regulatory requirements. Question 2. Benchmark analysis indicates that a patient is asking for a detailed explanation of how their new medication, a specific antihypertensive, works at the cellular and molecular level to lower their blood pressure. Which of the following approaches best demonstrates the pharmacy technician's understanding of the drug's mechanism of action in accordance with ExCPT standards? Option A. Explaining the drug's mechanism of action using complex biochemical terminology and detailed pathway diagrams. Option B. Describing how the drug interacts with specific cellular targets, such as receptors or enzymes, and the resulting physiological effect at the molecular level. Option C. Listing all potential side effects associated with the medication and explaining their possible causes. Option D. Providing a general overview of the drug's therapeutic class and its common uses in treating hypertension. Correct answer is B. Describing how the drug interacts with specific cellular targets, such as receptors or enzymes, and the resulting physiological effect at the molecular level. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the pharmacy technician to accurately interpret and communicate complex pharmacological information to a patient. The patient's request for a detailed explanation of a drug's mechanism of action, specifically how it interacts at the cellular and molecular level, goes beyond typical dispensing duties and necessitates a deep understanding of pharmacology. Misinterpreting or oversimplifying this information could lead to patient confusion, non-adherence, or even adverse events if the patient misunderstands the drug's effects or limitations. The technician must balance providing helpful information with staying within their scope of practice and ensuring the information is accurate and understandable. Correct approach analysis. The correct approach involves the pharmacy technician accurately describing the drug's mechanism of action by focusing on its interaction with specific cellular targets, such as receptors or enzymes, and the subsequent biochemical cascade or effect. This aligns with the ExCPT exam's emphasis on understanding drug actions at a fundamental level. For example, explaining that a beta blocker works by competitively inhibiting the binding of epinephrine and norepinephrine to beta-adrenergic receptors, thereby reducing heart rate and blood pressure, demonstrates this understanding. This approach is ethically sound as it promotes patient education and empowerment, enabling informed decision-making regarding their medication. It also adheres to the principle of providing accurate information, a cornerstone of patient care within the pharmacy setting. While the technician may not be able to provide the same depth of explanation as a pharmacist, they can convey the core mechanism in a clear and concise manner. Incorrect approaches analysis. Providing a generic overview of the drug's therapeutic class without detailing the cellular or molecular interaction is an incorrect approach. This fails to meet the patient's specific request for a deeper understanding of how the drug works at a fundamental level and misses an opportunity for comprehensive patient education. It is a superficial explanation that does not demonstrate the required depth of knowledge for the ExCPT exam. Explaining the drug's mechanism of action by listing all potential side effects instead of its primary therapeutic action is also an incorrect approach. While side effects are important to discuss, they are distinct from the drug's intended mechanism of action. This approach misinterprets the patient's query and could cause unnecessary anxiety about adverse events without explaining how the drug is intended to work. Describing the drug's mechanism of action in highly technical jargon and complex biochemical pathways that are not easily understood by a layperson is another incorrect approach. While technically accurate, it fails to achieve effective patient communication. The goal is to educate the patient, and if the explanation is incomprehensible, it is ineffective and can lead to confusion and frustration, undermining patient adherence and understanding. Professional reasoning. When faced with a patient's request for detailed pharmacological information, a pharmacy technician should first assess the complexity of the request in their own knowledge base. If the request falls within their scope of practice and understanding, they should aim to provide a clear, accurate, and concise explanation, focusing on the core mechanism of action at the cellular or molecular level. This involves identifying the drug's target e.g., receptor, enzyme, the type of interaction e.g., agonist, antagonist, inhibitor, and the immediate consequence of that interaction. If the request is too complex or requires clinical judgment beyond their training, the technician should politely defer to the pharmacist, explaining that they can provide a more comprehensive explanation. This ensures the patient receives accurate and appropriate information while maintaining professional boundaries and ethical responsibilities. Question 3. The risk matrix shows a new prescription for amlodipine 5 mg daily for a patient with a history of atrial fibrillation managed with amiodarone. What is the most appropriate action for the pharmacy technician to take regarding this prescription? Option A. Alert the supervising pharmacist to a potential drug interaction between amlodipine and amiodarone that could affect cardiac rhythm and conduction. Option B. Inform the patient that amiodarone is a strong medication and they should discuss any new prescriptions with their cardiologist. Option C. Dispense the amlodipine as prescribed, as it is a common antihypertensive and unlikely to cause significant issues with amiodarone. Option D. Advise the patient that amlodipine may cause dizziness and they should monitor their blood pressure closely. The correct answer is A. Alert the supervising pharmacist to a potential drug interaction between amlodipine and amiodarone that could affect cardiac rhythm and conduction. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the pharmacy technician to identify potential drug interactions involving a new antihypertensive medication and a patient's existing antiarrhythmic therapy. Misinterpreting or failing to recognize these interactions could lead to serious adverse cardiovascular events for the patient, such as bradycardia, hypotension, or exacerbation of arrhythmias, directly impacting patient safety and treatment efficacy. Accurate identification is crucial for timely intervention and communication with the pharmacist. Correct approach analysis. The correct approach involves recognizing that amlodipine, a calcium channel blocker used as an antihypertensive, can have additive effects with certain antiarrhythmics, particularly those that also affect cardiac conduction or heart rate. Specifically, amlodipine can prolong the PR interval and potentially exacerbate bradycardia when used with drugs like beta blockers or certain class I and Roman III antiarrhythmics. The pharmacy technician's role, as defined by ExCPT standards and general pharmacy practice guidelines, is to identify potential drug interactions and bring them to the attention of the supervising pharmacist for further evaluation and patient counseling. This proactive identification aligns with the technician's responsibility to support safe medication use and prevent adverse drug events, a core tenet of pharmacy practice. Incorrect approach is analysis. An incorrect approach would be to assume that amlodipine is solely for blood pressure management and has no significant interaction potential with the patient's antiarrhythmic medication. This overlooks the pharmacodynamic properties of amlodipine and its potential to affect cardiac rhythm and conduction, leading to a failure to flag a critical safety concern. This approach violates the principle of diligent medication review and patient safety. Another incorrect approach would be to dismiss the potential interaction because the patient has not reported any symptoms. Patient-reported symptoms are often a lagging indicator of adverse drug events. Proactive identification of potential interactions, based on known pharmacological principles and drug databases, is essential to prevent harm before it manifests. Relying solely on patient reporting is a passive and potentially dangerous approach. A third incorrect approach would be to provide direct patient counseling on the interaction. Pharmacy technicians are not authorized to provide direct patient counseling on drug interactions or therapeutic recommendations. This responsibility rests solely with the licensed pharmacist. A technician providing such advice would be practicing pharmacy without a license and could provide inaccurate or incomplete information, jeopardizing patient care. Professional reasoning. Pharmacy technicians are integral members of the healthcare team, supporting pharmacists in ensuring safe and effective medication therapy. When presented with a new prescription for a patient with existing medications, a technician should utilize available resources, such as drug interaction checkers and their knowledge base, to identify potential issues. The primary responsibility is to flag any potential concerns to the supervising pharmacist, who will then conduct a comprehensive review, assess the clinical significance, and implement appropriate interventions, including patient counseling. This tiered approach ensures that patient safety is paramount and that all interventions are performed within the scope of practice for each healthcare professional. Question 4. What factors determine the comprehensive identification of potential drug interactions, including those involving food and herbal supplements, when assisting a pharmacist in patient care? Option A. The patient's current prescription medications and any over-the-counter drugs they report taking, without considering herbal or dietary supplements. Option B. The patient's current prescription medications and any over-the-counter drugs they report taking, relying solely on the patient's memory and disclosure. Option C. The patient's current prescription medications, with a focus on interactions that are commonly known or frequently encountered. Option D. The patient's current prescription medications, over-the-counter drug purchases, and reported use of herbal or dietary supplements, cross-referenced with up-to-date drug interaction databases and resources. The correct answer is D. The patient's current prescription medications, over-the-counter drug purchases, and reported use of herbal or dietary supplements, cross-referenced with up-to-date drug interaction databases and resources. Explanation. This scenario is professionally challenging because accurately identifying and communicating potential drug interactions, including those involving food and herbal products, is a critical patient safety function for pharmacy technicians. Failure to do so can lead to adverse drug events, reduced therapeutic efficacy, or even serious harm. The complexity arises from the vast number of potential interactions and the need to consider not just prescription medications, but also over-the-counter products and dietary supplements, which patients may not always disclose. The correct approach involves a comprehensive review of the patient's medication profile, including all prescription drugs, over-the-counter medications, and herbal supplements, cross-referenced with reliable drug interaction databases and resources. This approach is correct because it aligns with the pharmacy technician's role in assisting the pharmacist with medication therapy management and ensuring patient safety. Regulatory frameworks, such as those overseen by the National Association of Boards of Pharmacy, (NAP), and interpreted by the ExCPT exam, emphasize the importance of accurate dispensing and the technician's responsibility to flag potential issues for pharmacist review. Ethical considerations also mandate a commitment to patient well-being, which includes proactively identifying and mitigating risks associated with drug interactions. An incorrect approach would be to only consider prescription drug-to-drug interactions and ignore over-the-counter medications and herbal supplements. This is a regulatory and ethical failure because it creates a significant blind spot in patient safety. Many herbal products and common over-the-counter drugs can have profound interactions with prescription medications, and failing to account for them violates the principle of comprehensive medication review. Another incorrect approach would be to rely solely on patient self-reporting of all substances they are taking without independent verification or cross-referencing with databases. While patient input is valuable, it is prone to omissions or inaccuracies, and professional responsibility requires a more robust verification process. Relying on outdated or incomplete drug interaction resources would also be a failure, as it could lead to missed interactions and compromise patient care. The professional decision-making process for similar situations should involve a systematic approach. First, gather all available patient information, including prescription history, over-the-counter purchases, and any disclosed herbal or dietary supplements. Second, utilize current, reputable drug interaction screening software and reference materials to identify potential interactions. Third, critically evaluate the identified interactions for clinical significance, considering factors like dosage, duration of therapy, and patient-specific conditions. Fourth, communicate any significant potential interactions clearly and concisely to the supervising pharmacist for further assessment and patient counseling. This layered approach ensures that all relevant factors are considered, minimizing the risk of adverse events and upholding the highest standards of patient care. Question 5. Examination of the data shows a prescription for amoxicillin 500 mg written for a pediatric patient with a suspected ear infection. The pharmacy has amoxicillin available as oral suspension, chewable tablets, and intravenous solution. The patient's chart indicates a history of difficulty swallowing pills. What is the most appropriate course of action for the pharmacy technician? Option A. Dispense the amoxicillin chewable tablets. Option B. Dispense the amoxicillin intravenous solution. Option C. Contact the prescriber to clarify the intended dosage form and route of administration. Option D. Dispense the amoxicillin oral suspension. Correct answer is D. Dispense the amoxicillin oral suspension. Explanation. This scenario is professionally challenging because it requires the pharmacy technician to interpret a physician's order for a medication that has multiple available dosage forms and routes of administration, and to identify the most appropriate and safest option based on the patient's condition and the medication's properties. The technician must exercise sound professional judgment, adhering strictly to the ExCPT exam's regulatory framework, which emphasizes patient safety and adherence to prescriber intent, while also considering practical and therapeutic implications. The correct approach involves recognizing that the physician's order, while specifying the medication, is ambiguous regarding the dosage form and route. The technician's responsibility is to clarify this ambiguity with the prescriber before dispensing. This ensures that the medication is administered in a way that is therapeutically effective, safe for the patient, and aligns with the prescriber's intended treatment. This aligns with the core principles of pharmacy practice, which prioritize patient well-being and accurate medication dispensing, as implicitly guided by the ExCPT framework's focus on competency and ethical practice. An incorrect approach would be to assume the most common dosage form or route without verification. For instance, dispensing an oral tablet when the patient may have difficulty swallowing, or when an intravenous formulation is indicated for faster onset of action would be a significant error. Another incorrect approach would be to dispense a different dosage form or route than what was likely intended, such as substituting an intramuscular injection for an intravenous infusion without explicit prescriber authorization. These actions bypass the essential step of professional verification, potentially leading to therapeutic failure, adverse drug events, or patient harm, all of which are contrary to the ethical and regulatory standards expected of a certified pharmacy technician. The professional decision-making process in such situations should involve a systematic evaluation of the prescription. First, identify any ambiguities or potential safety concerns. Second, consult reliable drug information resources to understand the available dosage forms, routes of administration, and their respective indications and contraindications. Third, if ambiguity persists or safety is a concern, the technician must communicate with the prescribing physician or pharmacist to obtain clarification and confirm the intended therapy. This collaborative approach ensures patient safety and adherence to the prescriber's orders. Question 6. When evaluating a prescription for a patient who has previously been counseled by the pharmacist about a severe contraindication for a specific medication, and the patient now insists on receiving this medication, what is the most appropriate action for a certified pharmacy technician to take? Option A. Advise the patient to speak with their doctor and then dispense the medication. Option B. Dispense the medication as prescribed, assuming the patient understands the risks. Option C. Inform the pharmacist immediately about the patient's request and the known contraindication. Option D. Refuse to dispense the medication and tell the patient about the contraindication. The correct answer is C. Inform the pharmacist immediately about the patient's request and the known contraindication. Explanation. This scenario presents an ethical dilemma for a pharmacy technician by requiring them to navigate a patient's request that potentially conflicts with established drug safety guidelines. The challenge lies in balancing patient autonomy and the technician's duty to uphold professional standards and patient safety, which are paramount in pharmacy practice. The technician must recognize the potential harm associated with a known contraindication and act responsibly without overstepping their scope of practice. The correct approach involves recognizing the contraindication, communicating the concern to the pharmacist, and allowing the pharmacist to address the situation with the patient. This upholds the technician's role as a vital member of the pharmacy team, supporting the pharmacist's ultimate responsibility for patient care and drug therapy management. This aligns with the ExCPT exam's emphasis on patient safety and the technician's role in assisting the pharmacist. Specifically, the technician's actions are guided by the principle of do no harm and the regulatory framework that mandates reporting potential drug-related issues to the supervising pharmacist. The technician is not authorized to make clinical judgments about drug therapy or to override a known contraindication. An incorrect approach would be to fulfill the prescription without question. This fails to uphold the technician's responsibility to identify and report potential safety issues, directly violating the principle of patient safety and potentially leading to adverse drug events. It also circumvents the pharmacist's role in clinical decision-making. Another incorrect approach would be to refuse to fill the prescription outright and inform the patient of the contraindication without involving the pharmacist. While the intention might be to protect the patient, this oversteps the technician's scope of practice. The technician is not licensed to provide direct patient counseling on contraindications or to make independent decisions about dispensing. This action bypasses the pharmacist's expertise and the established workflow for managing potential drug interactions or contraindications. Finally, an incorrect approach would be to dismiss the patient's request as unimportant and proceed with dispensing. This demonstrates a lack of diligence and a failure to recognize the seriousness of contraindications, which are established based on significant risks of harm. It prioritizes expediency over patient well-being and disregards the importance of the pharmacist's oversight. The professional decision-making process in such situations involves a clear understanding of one's scope of practice, a commitment to patient safety, and effective communication within the pharmacy team. When a potential safety concern arises, the technician's primary responsibility is to bring it to the attention of the pharmacist, who is equipped to make the final clinical determination and communicate with the patient. Question 7. The efficiency study reveals that a new generic formulation of a medication exhibits lower bioavailability compared to the brand-name drug due to differences in its inactive ingredients and particle size. As a pharmacy technician, what is the most appropriate action to take when filling a prescription for this generic? Option A. Flag this information for the pharmacist to review potential implications for patient therapy and counseling. Option B. Dispense the medication as usual, as bioavailability differences are typically minor and do not affect patient outcomes. Option C. Advise the patient that the generic is less effective and recommend they request the brand name drug from their prescriber. Option D. Document the bioavailability difference in the patient's profile, but take no further action. The correct answer is A. Flag this information for the pharmacist to review potential implications for patient therapy and counseling. Explanation. The efficiency study reveals a common scenario in pharmacy practice where a technician must interpret information about drug absorption and its impact on patient care. The challenge lies in understanding how various factors influence a drug's ability to reach the bloodstream and exert its therapeutic effect, and then applying this knowledge to ensure appropriate dispensing and patient counseling. This requires a technician to go beyond simply reading a label and to consider the underlying pharmacological principles as they relate to real-world patient outcomes, all within the scope of their practice as defined by ExCPT standards. The correct approach involves recognizing that drug absorption is a complex process influenced by multiple factors, and that bioavailability is a measure of this efficiency. Understanding that a drug's formulation, route of administration, and patient-specific factors, like food intake or gastrointestinal health, can significantly alter how much of the active ingredient reaches systemic circulation is crucial. This knowledge directly impacts dispensing decisions, such as whether to counsel a patient on taking a medication with or without food, or to flag a potential issue with a specific dosage form for the pharmacist. The ExCPT framework emphasizes the technician's role in supporting safe and effective medication use, which includes understanding these fundamental pharmacokinetic principles to identify potential problems and assist the pharmacist. An incorrect approach would be to dismiss the information about absorption and bioavailability as purely theoretical or outside the technician's purview. This failure to connect pharmacological concepts to practical pharmacy operations is a significant ethical and professional lapse. It could lead to dispensing medications without considering factors that might compromise their efficacy or safety, potentially resulting in subtherapeutic doses or increased adverse effects for the patient. Another incorrect approach would be to overstep the technician's scope of practice by attempting to provide definitive medical advice or make independent clinical judgments about drug therapy. The ExCPT certification prepares technicians to identify and communicate potential issues to the pharmacist, not to diagnose or prescribe. Professionals should use a decision-making framework that prioritizes patient safety and adherence to regulatory guidelines. This involves 1. Actively seeking to understand the information presented, especially when it relates to drug action. 2. Connecting this information to practical pharmacy tasks and patient care. 3. Identifying potential implications for medication efficacy or safety. 4. Communicating any concerns or observations to the supervising pharmacist in a clear and concise manner. This systematic approach ensures that the technician functions effectively as part of the pharmacy team, contributing to optimal patient outcomes within their defined responsibilities. Question 8. Stakeholder feedback indicates that caregivers of pediatric patients are sometimes unsure about the most accurate way to administer liquid oral medications dispensed from the pharmacy, leading to potential dosing errors. A pharmacy technician is preparing a prescription for a liquid antibiotic for a 3-year-old child. The prescription does not specify a particular administration device. Which of the following approaches best addresses this feedback and ensures safe and accurate medication administration? Option A. Rely on the caregiver's stated experience with administering similar medications to their child. Option B. Assume the standard oral syringe provided with the medication is sufficient for accurate dosing. Option C. Consult the supervising pharmacist to determine the most appropriate administration device and technique for this specific liquid medication and pediatric patient. Option D. Pour the liquid medication into a disposable cup and instruct the caregiver to administer it. The correct answer is C. Consult the supervising pharmacist to determine the most appropriate administration device and technique for this specific liquid medication and pediatric patient. Explanation. This scenario is professionally challenging because it requires the pharmacy technician to balance efficiency with patient safety and adherence to regulatory requirements for medication administration. Technician must ensure that the chosen method of administering oral medications to a pediatric patient is both effective and compliant with best practices and any applicable state or federal guidelines governing pharmacy operations and patient care. The correct approach involves consulting the pharmacist for guidance on the most appropriate administration technique for the specific liquid medication, considering the patient's age and any specific instructions on the prescription. This is the best professional practice because the pharmacist is ultimately responsible for verifying the accuracy and appropriateness of dispensed medications and providing patient counseling. The pharmacy technician's role is to support the pharmacist and ensure that all tasks are performed under their supervision or according to established protocols. This aligns with the ExCPT exam's emphasis on the technician working under the direct supervision of a licensed pharmacist and adhering to established pharmacy policies and procedures, which are designed to ensure patient safety and regulatory compliance. An incorrect approach of assuming the standard oral syringe is sufficient without pharmacist consultation fails to acknowledge the potential for variations in medication viscosity, concentration, or specific administration requirements that might necessitate a different measuring device or technique. This could lead to inaccurate dosing, which is a serious patient safety risk and a violation of professional responsibility. Another incorrect approach of simply pouring the liquid into a cup and instructing the caregiver to administer it is also unacceptable. This method is prone to significant inaccuracies in dosing, especially with small volumes required for pediatric patients, and bypasses the critical step of ensuring proper measurement and administration techniques, potentially violating regulations related to dispensing and patient counseling. Lastly, an approach of relying solely on the caregiver's prior experience without verification or pharmacist input is risky. While caregivers may have experience, each medication and patient can present unique challenges, and the pharmacy has a responsibility to ensure correct administration, not to delegate that responsibility entirely to the caregiver without professional oversight. Professionals should use a decision-making framework that prioritizes patient safety and regulatory compliance. When faced with a situation involving medication administration, especially for vulnerable populations like children, the first step should always be to confirm understanding of the medication and its administration requirements. If there is any doubt, or if the situation deviates from standard practice, consulting the supervising pharmacist is paramount. This ensures that all actions are taken within the scope of practice for a pharmacy technician and in accordance with established pharmacy protocols and legal requirements. Question 9. Regulatory review indicates that a patient is prescribed a metered-dose inhaler, MDI, for their asthma, a dry powder inhaler, DPI, for their cough, and a nebulizer for acute symptom relief. Which of the following approaches by the pharmacy technician best ensures the patient's understanding and proper use of these distinct inhalation medications? Option A. Demonstrate the proper use of the MDI, DPI, and nebulizer to the patient, explaining the unique steps for each device, and then ask the patient to demonstrate their technique back to the technician. Option B. Briefly explain the purpose of each medication and instruct the patient to ask their doctor for specific usage instructions. Option C. Provide the patient with a single handout detailing general instructions for all types of inhalers and ask if they have any questions. Option D. Advise the patient to refer to the manufacturer's instructions included with each device and assume they will understand how to use them. The correct answer is C. Provide the patient with a single handout detailing general instructions for all types of inhalers and ask if they have any questions. Explanation. This scenario is professionally challenging because it requires the pharmacy technician to assess a patient's understanding of multiple, distinct inhalation devices and provide accurate, device-specific counseling. The challenge lies in ensuring the patient can effectively use the prescribed medication, which directly impacts therapeutic outcomes and patient safety. Misinformation or incomplete counseling can lead to medication non-adherence, exacerbation of respiratory conditions, and potential adverse events. The correct approach involves the pharmacy technician demonstrating each device to the patient, explaining its specific use, and confirming the patient's comprehension through teachback. This aligns with the ExCPT exam's emphasis on patient education and the technician's role in supporting safe medication use. Specifically, the technician must understand the nuances of MDIs, G. Shaking, priming, slow inhalation, breath holding. DPI e.g. proper loading, forceful inhalation, no shaking, and nebulizers e.g. correct assembly, mask/mouthpiece use, duration of treatment. This comprehensive hands-on approach ensures the patient receives accurate information tailored to their specific devices, promoting adherence and efficacy, which is a core ethical responsibility for pharmacy personnel. An incorrect approach would be to provide generic instructions applicable to all inhalers. This fails to acknowledge the significant differences in device operation and can lead to improper technique for one or more of the prescribed medications. For example, advising a patient to shake a DPI would render it ineffective, and failing to instruct on breath holding after an MDI can reduce medication deposition in the lungs. Another incorrect approach is to assume the patient is already proficient without verification. This bypasses the crucial step of assessing current knowledge and skills, potentially leaving the patient with critical gaps in their understanding. Relying solely on the prescriber to provide this detailed instruction is also insufficient, as the pharmacy technician often serves as the primary point of contact for medication use questions and has a responsibility to reinforce and clarify instructions. The professional decision-making process should involve a systematic assessment of the patient's needs. Upon receiving a prescription for multiple inhalation devices, the technician should proactively identify the need for device-specific counseling. This involves reviewing the prescription, understanding the different device types, and preparing to demonstrate and explain each one. The technician should then engage the patient, assess their current knowledge, provide clear, step-by-step instructions for each device, and utilize the teach-back method to confirm understanding. This iterative process ensures that the patient is empowered to use their medications correctly and safely. Question 10. Process analysis reveals that a prescription is received for hydrocortisone cream 1% to affected area BID. The pharmacy technician is preparing the medication for dispensing. Considering the distinct properties of topical formulations and their application methods, which of the following represents the most appropriate action to ensure correct patient use? Option A. Recommend that the patient apply a generous amount of the cream to the affected area twice daily, covering it with a bandage. Option B. Instruct the patient to apply a thin layer of the cream to the affected area twice daily, ensuring the area is clean and dry before application. Option C. Advise the patient to rub the cream into the affected area until it is fully absorbed twice daily. Option D. Inform the patient that creams are generally applied by dabbing them onto the skin twice daily. The correct answer is B. Instruct the patient to apply a thin layer of the cream to the affected area twice daily, ensuring the area is clean and dry before application. Explanation. This scenario is professionally challenging because it requires the pharmacy technician to interpret a physician's order for a topical medication and determine the most appropriate application method based on the medication's formulation and the patient's condition, all while adhering to strict regulatory guidelines for dispensing. The risk lies in misinterpreting the order or the medication's properties, potentially leading to incorrect application, reduced efficacy, or adverse patient outcomes. Careful judgment is required to ensure patient safety and therapeutic effectiveness. The correct approach involves understanding the distinct properties of creams, ointments, and lotions, and how they are intended to be applied. Creams and lotions are generally water-based and spread easily, suitable for larger areas or where absorption is desired. Ointments are oil-based, providing a protective barrier, and are often used for dry, scaly conditions or where prolonged contact is needed. Patches are designed for transdermal delivery. The technician must assess the prescribed medication's form and the physician's intent to ensure the patient receives clear, accurate instructions for optimal use. Aligning with the ExCPT, exams focus on practical application and patient counseling support. This aligns with the general principles of patient care and medication safety mandated by pharmacy regulations, emphasizing accurate dispensing and clear communication. An incorrect approach would be to assume all topical medications are applied in the same manner, regardless of their formulation. For instance, advising a patient to rub in a thick, occlusive ointment, as if it were a light lotion, could lead to reduced therapeutic effect or skin irritation. Similarly, failing to instruct on proper patch application, such as not cleaning the skin or applying it over broken skin, can compromise drug delivery and patient safety. Another incorrect approach is to provide vague or incomplete instructions, leaving the patient to guess the correct application method. These failures represent a breach of professional responsibility and potentially violate regulations that require accurate dispensing and patient education to ensure safe and effective medication use. Professionals should employ a decision-making framework that begins with a thorough review of the prescription, identifying the medication, its dosage form, and the intended route of administration. Next, they should access their knowledge base regarding the properties of different topical formulations and their typical application methods. If there is any ambiguity or uncertainty regarding the physician's intent or the appropriate application for a specific formulation, the technician should consult with the pharmacist. This collaborative approach ensures that the patient receives accurate and comprehensive instructions, promoting adherence and optimal therapeutic outcomes, in line with the ethical and regulatory standards of the pharmacy profession. Question 11. The assessment process reveals a patient calling the pharmacy reporting that they have developed a rash and are feeling nauseous shortly after starting a new prescription medication. The patient sounds distressed. Option A. Recommend that the patient take an over-the-counter antihistamine for the rash and an antacid for the nausea. Option B. Instruct the patient to stop taking the new medication immediately without consulting the pharmacist or prescriber. Option C. Advise the patient to wait and see if the rash and nausea improve on their own over the next 24 hours. Option D. Immediately inform the supervising pharmacist about the patient's reported symptoms and distress. The correct answer is D. Immediately inform the supervising pharmacist about the patient's reported symptoms and distress. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the pharmacy technician to act as a crucial first point of contact for a patient experiencing a potentially serious adverse drug reaction. The technician must quickly assess the situation, recognize the urgency, and initiate appropriate communication protocols without overstepping their scope of practice. The challenge lies in balancing patient safety, adherence to pharmacy policy, and the need for timely medical intervention. Correct approach analysis. The correct approach involves immediately notifying the pharmacist. This is the most appropriate action because the pharmacy technician's scope of practice, as defined by ExCPT standards and relevant state board of pharmacy regulations, which would be the governing framework for the ExCPT exam, does not permit them to provide medical advice or independently manage adverse drug reactions. The pharmacist is licensed and trained to assess the severity of the reaction, consult with the patient, and determine the necessary course of action, which may include advising the patient to seek immediate medical attention or contacting the prescriber. This ensures patient safety and compliance with regulatory requirements for pharmacist oversight. Incorrect approaches analysis. Advising the patient to simply wait and see if it gets better is an incorrect approach because it fails to recognize the potential severity of an adverse drug reaction and delays necessary medical evaluation. This could lead to a worsening of the patient's condition and potential harm, violating the ethical principle of beneficence and potentially breaching pharmacy regulations regarding patient care and safety. Suggesting the patient stop taking the medication without consulting the pharmacist or prescriber is also an incorrect approach. While stopping a medication might be necessary, making this recommendation independently falls outside the pharmacy technician's scope of practice. It could lead to abrupt discontinuation of a critical medication, causing withdrawal symptoms or disease exacerbation, and bypasses the pharmacist's and prescriber's roles in managing drug therapy. This action could violate regulations concerning medication management and professional conduct. Recommending over-the-counter remedies for the symptoms without a pharmacist's assessment is incorrect because it constitutes providing medical advice and treatment recommendations. The technician cannot determine if the over-the-counter remedy is appropriate or if it might interact with the patient's current medications or exacerbate the underlying adverse reaction. This action exceeds the technician's scope and could lead to adverse health outcomes, violating patient safety standards and regulatory guidelines. Professional reasoning. When faced with a patient reporting a potential adverse drug reaction, the pharmacy technician should follow a clear decision-making process. 1. Listen attentively to the patient's reported symptoms. 2. Recognize that adverse drug reactions require professional medical assessment. 3. Immediately escalate the situation to the supervising pharmacist, clearly and concisely relaying the patient's reported symptoms and concerns. 4. Allow the pharmacist to take over the patient interaction and determine the appropriate next steps, which may include further patient counseling, contacting the prescriber, or advising the patient to seek emergency medical care. This systematic approach ensures patient safety, adheres to professional responsibilities, and complies with regulatory frameworks governing pharmacy practice. Question 12. Strategic planning requires a pharmacy technician to understand the fundamental processes that affect drug therapy. When a patient inquires about how their body processes a new medication, what is the most accurate and professionally responsible explanation technician can provide regarding drug metabolism? Option A. Drug metabolism is the process by which the liver breaks down drugs into compounds that are easier for the body to eliminate, which can affect how long the drug stays in the system and its overall effect. Option B. Drug metabolism is when the body creates more of the drug molecule to make it stronger and last longer in the body. Option C. Drug metabolism primarily happens in the kidneys and is responsible for how well a drug is absorbed into the bloodstream. Option D. Drug metabolism is not important for how a drug works. It only determines where the drug is stored in the body, like in fat tissues. The correct answer is A. Drug metabolism is the process by which the liver breaks down drugs into compounds that are easier for the body to eliminate, which can affect how long the drug stays in the system and its overall effect. Explanation. Scenario analysis. This scenario presents a professional challenge because a pharmacy technician is tasked with understanding and communicating information about drug metabolism, a complex physiological process that directly impacts patient safety and therapeutic outcomes. Misinterpreting or inaccurately relaying this information can lead to incorrect dosing, adverse drug reactions, or reduced efficacy. The technician must rely on their knowledge of drug metabolism principles and the pharmacy's established protocols for patient education, ensuring that the information provided is both accurate and appropriate for the patient's understanding. Correct approach analysis. The correct approach involves the pharmacy technician accurately identifying that drug metabolism, primarily occurring in the liver, influences how a drug is broken down and eliminated from the body. This understanding is crucial for recognizing potential drug-drug interactions or the need for dose adjustments in patients with impaired liver function. The technician's role is to relay this information in a clear, concise, and understandable manner to the patient, adhering to the pharmacy's patient counseling guidelines and scope of practice, which typically involves informing the pharmacist of any complex patient questions or concerns that require their expertise. This aligns with the ExCPT exam's focus on foundational knowledge of drug actions and patient safety. Incorrect approaches analysis. One incorrect approach is to state that drug metabolism primarily occurs in the kidneys and affects drug absorption. This is incorrect because while the kidneys are crucial for drug excretion, metabolism, the breakdown of drugs, is predominantly a hepatic liver function. Furthermore, metabolism influences drug elimination and can alter drug activity, not primarily absorption. This demonstrates a fundamental misunderstanding of pharmacokinetic principles, which is a core area tested by the ExCPT. Another incorrect approach is to claim that drug metabolism is a process where the body builds up drug molecules to increase their potency. This is fundamentally flawed. Metabolism is a breakdown process, often converting active drugs into inactive metabolites or facilitating their excretion. This misrepresentation of the metabolic process can lead to dangerous misconceptions about drug effects and duration of action, directly contravening patient safety principles emphasized in pharmacy technician training. A further incorrect approach is to suggest that drug metabolism is irrelevant to how a drug works and only affects how it is stored in fat cells. While some drugs can be stored in adipose tissue, this is a separate pharmacokinetic process, distribution and storage, not metabolism. Metabolism is directly involved in altering the drug's chemical structure to facilitate its elimination, and can inactivate or activate the drug, directly impacting its therapeutic effect and duration. This demonstrates a lack of understanding of the core functions of drug metabolism. Professional reasoning. When faced with questions about drug actions, including metabolism, pharmacy technicians should first access their foundational knowledge base, as tested by the ExCPT. They should then consult reliable pharmacy resources and adhere to their pharmacy's specific policies and procedures for patient communication. If a patient's question delves into complex pharmacological concepts or requires personalized medical advice, the technician's professional responsibility is to involve the pharmacist, ensuring accurate and safe patient care. This tiered approach prioritizes patient safety and upholds the technician's scope of practice. Question 13. Research into a patient's new prescription for albuterol sulfate inhalation solution reveals they are also purchasing a significant quantity of an over-the-counter nasal decongestant spray containing oxymetazoline hydrochloride. As a pharmacy technician working under the direct supervision of a licensed pharmacist, what is the most appropriate action to take? Option A. Advise the patient that they should not use the nasal decongestant spray while using their albuterol inhaler. Option B. Alert the supervising pharmacist to the potential interaction between the prescribed bronchodilator and the over-the-counter nasal decongestant. Option C. Dispense both medications as prescribed and purchased without further action. Option D. Assume the patient is aware of any potential interactions and proceed with dispensing. The correct answer is B. Alert the supervising pharmacist to the potential interaction between the prescribed bronchodilator and the over-the-counter nasal decongestant. Explanation. This scenario is professionally challenging because it requires the pharmacy technician to identify a potential drug interaction involving a respiratory medication and a commonly prescribed over-the-counter OC product, which could have significant health consequences for the patient. The technician must exercise sound judgment to ensure patient safety and adhere to professional responsibilities. The correct approach involves recognizing the potential for a drug interaction between the prescribed bronchodilator and the OTC nasal decongestant. This approach is correct because it prioritizes patient safety by proactively identifying a potential adverse drug event. The ExCPT exam emphasizes the technician's role in assisting pharmacists with drug therapy management, which includes recognizing and flagging potential issues. Federal regulations, such as those enforced by the FDA and interpreted by state boards of pharmacy, mandate that pharmacy personnel act in the best interest of the patient. This includes reporting potential drug interactions to the pharmacist for review. The technician's responsibility is to observe, identify, and report, not to make the final clinical decision. An incorrect approach would be to dispense the medications without comment. This fails to uphold the technician's duty to patient safety and bypasses the pharmacist's critical oversight role. Ethically and regulatorily, this constitutes a failure to act as a diligent member of the pharmacy team. Another incorrect approach would be to advise the patient directly about the interaction and suggest they not take the OTC medication. While well-intentioned, this oversteps the technician's scope of practice. Pharmacy technicians are not licensed to provide direct patient counseling on drug interactions or therapeutic recommendations. This action could lead to patient confusion or inappropriate self-management of their health. A third incorrect approach would be to ignore the potential interaction, assuming the patient is aware or that it is not significant. This demonstrates a lack of vigilance and a failure to adhere to the principle of do no harm. It neglects the technician's responsibility to contribute to the safe and effective dispensing of medications. Professionals should use a decision-making framework that involves 1. Patient assessment, reviewing the prescription and patient profile for any potential red flags. 2. Knowledge application, accessing and applying knowledge of drug classes, common interactions, and contraindications. 3. Communication protocol, following established procedures for communicating concerns to the supervising pharmacist. 4. Scope of practice awareness, understanding the boundaries of their role and responsibilities. Question 14. To address the challenge of ensuring accurate patient care by understanding the broad applications of medications, a pharmacy technician is asked to identify the primary therapeutic uses for a specific drug class. Which of the following accurately lists the conditions treated by the specified drug class? Option A. Beta blockers are primarily used to treat bacterial infections and fungal infections. Option B. Beta blockers are primarily used to treat hypertension, angina pectoris, arrhythmias, and heart failure. Option C. Beta blockers are primarily used to block the action of adrenaline on beta-adrenergic receptors. Option D. Beta blockers are primarily used to treat insomnia, anxiety, and nausea. The correct answer is B. Beta blockers are primarily used to treat hypertension, angina pectoris, arrhythmias, and heart failure. Explanation. This scenario is professionally challenging because it requires a pharmacy technician to accurately recall and apply knowledge of drug classes and their therapeutic uses to a patient's specific condition, directly impacting patient care and safety. Misinformation can lead to incorrect medication selection, potential adverse drug events, or failure to treat the underlying condition effectively. The ExCPT exam emphasizes the technician's role in supporting the pharmacist by demonstrating a foundational understanding of pharmacology, including therapeutic indications. The correct approach involves identifying the drug class and then accurately associating it with the primary therapeutic uses for which it is prescribed, aligning with the comprehensive list of conditions treated by each drug class, as expected for ExCPT certification. This demonstrates the technician's ability to understand the rationale behind medication therapy, a critical component of safe medication dispensing and patient counseling support. Regulatory frameworks for pharmacy practice, including those tested by ExCPT, mandate that pharmacy personnel possess adequate knowledge to perform their duties safely and effectively. This includes understanding the basic indications of common drug classes to assist pharmacists and ensure appropriate medication is dispensed. An incorrect approach that focuses on a drug class's mechanism of action without considering its primary therapeutic uses fails to address the core of the question, which is about what conditions the drug treats. While understanding mechanism of action is important, it is secondary to knowing the indications when assessing therapeutic appropriateness for a given condition. Another incorrect approach that lists only secondary or off-label uses, or uses for a different drug class entirely, represents a significant knowledge gap and a direct failure to meet the competency standards for a certified pharmacy technician. This could lead to dispensing errors or providing inaccurate information. A third incorrect approach that lists side effects instead of therapeutic uses is a fundamental misunderstanding of the question and the purpose of drug information. Side effects are adverse reactions, not conditions treated by the drug. Professional decision-making in such situations involves a systematic recall of drug class information, prioritizing known and common therapeutic indications. When unsure, the technician should consult reliable resources or seek clarification from the pharmacist, rather than guessing or providing incomplete information. The ExCPT exam tests this foundational knowledge to ensure technicians can contribute effectively to the pharmacy team and uphold patient safety standards. Question 15. Analysis of a scenario where a pharmacy technician is preparing to administer a prescribed intramuscular injection of a viscous antibiotic to an adult patient. The patient has a history of multiple previous injections in the deltoid muscle, resulting in some scarring and induration in that area. Which of the following approaches best demonstrates adherence to best practices for site selection and technique? Option A. Administer the injection into the scarred deltoid muscle, using a longer needle to penetrate the indurated tissue. Option B. Administer the injection into the vastus lateralis muscle, but use a standard needle length without considering the viscosity of the medication. Option C. Select the ventrogluteal site, ensuring proper landmarking to avoid the sciatic nerve, and utilize the Z-track method for injection. Option D. Administer the injection into the subcutaneous tissue of the abdomen, as it is a readily accessible area. The correct answer is A. Administer the injection into the scarred deltoid muscle, using a longer needle to penetrate the indurated tissue. Explanation. This scenario is professionally challenging because it requires a pharmacy technician to assess a patient's condition and select the most appropriate injection site and technique for a prescribed parenteral medication, directly impacting patient safety and therapeutic efficacy. The technician must balance the prescriber's order with their knowledge of anatomy, drug properties, and patient-specific factors. Careful judgment is required to prevent complications such as nerve damage, vascular injury, or inadequate drug absorption. The correct approach involves a thorough patient assessment, including reviewing the medication's properties e.g., viscosity, volume, the patient's physical condition e.g., muscle mass, skin integrity, presence of edema or scarring, and the intended route of administration. For intramuscular injections, selecting a site with adequate muscle mass and avoiding major nerves and blood vessels is paramount. The deltoid muscle is suitable for small volumes, while the ventrogluteal or vastus lateralis are preferred for larger volumes or irritating medications. For subcutaneous injections, the abdomen, upper arms, and thighs are common sites, chosen to ensure absorption and minimize tissue irritation. Intradermal injections require specific sites like the inner forearm, where the thinness of the skin facilitates wheal formation. The technique must also be appropriate, such as the Z-track method for IM injections to prevent medication leakage. This approach aligns with the ExCPT exam's emphasis on patient safety and the technician's role in assisting pharmacists with medication preparation and administration support, adhering to best practices, and the pharmacist's ultimate responsibility for medication therapy. An incorrect approach of administering an intramuscular injection into the upper outer quadrant of the buttock without considering the sciatic nerve is a significant regulatory and ethical failure. The site is associated with a high risk of sciatic nerve injury, which can lead to severe pain, paralysis, and long-term disability. Another incorrect approach of administering a viscous subcutaneous medication into an area with poor vascularity or significant adipose tissue without considering alternative sites or techniques could lead to poor absorption and reduced therapeutic effect, violating the principle of ensuring effective medication delivery. Administering an intradermal injection into the dermis rather than the epidermis would result in improper absorption and potential tissue damage, failing to meet the specific requirements of this route. Professional reasoning in such situations involves a systematic process. 1. Understand the prescriber's order and the medication's characteristics. 2. Assess the patient's individual needs and contraindications for specific injection sites. 3. Consult with the supervising pharmacist if any uncertainty exists regarding site selection, technique, or potential complications. 4. Prioritize patient safety and optimal drug delivery above all else. Question 16. The investigation demonstrates a pattern where a patient, who is prescribed multiple medications including atorvastatin Lipitor for hyperlipidemia and metformin glucophage for type 2 diabetes, has been repeatedly requesting early refills for both prescriptions. The patient also appears disoriented during some interactions and has occasionally presented with medication bottles that are nearly empty well before the scheduled refill date. What is the most appropriate immediate course of action for the pharmacy technician? Option A. Advise the patient that early refills cannot be provided and document the refusal. Option B. Immediately contact the patient's physician to report concerns about potential medication misuse. Option C. Discreetly observe the patient's behavior and medication storage at their next visit without any further action. Option D. Inform the supervising pharmacist of the observations and concerns regarding the patient's medication management and refill requests. Correct answer is D. Inform the supervising pharmacist of the observations and concerns regarding the patient's medication management and refill requests. Explanation. This scenario presents a professional challenge because it requires the pharmacy technician to balance patient confidentiality with the need to ensure appropriate medication use and prevent potential harm. The technician has observed a pattern of behavior that raises concerns about a patient's ability to manage their medication safely, but directly confronting the patient or reporting them without further investigation could violate privacy and trust. The core ethical and regulatory considerations revolve around patient safety, professional responsibility, and the principles of beneficence and non-maleficence, all within the framework of pharmacy practice regulations. The correct approach involves discreetly gathering more information and consulting with the pharmacist. This allows for a professional, evidence-based assessment of the situation without immediately breaching patient confidentiality or making assumptions. The pharmacist, as the ultimate responsible party for dispensing and patient care, can then determine the most appropriate course of action, which might include a direct conversation with the patient, involving their caregiver if appropriate, or other interventions to ensure safe medication management. This aligns with the ExCPT exam's emphasis on professional judgment, patient safety, and adherence to pharmacy law and ethics, which prioritize patient well-being while respecting their rights. An incorrect approach would be to immediately report the patient to external authorities without any internal consultation or further investigation. This bypasses the pharmacist's role and could lead to unnecessary intervention or stigma for the patient. Another incorrect approach is to ignore the observations, which would be a failure to act on a potential safety concern and a dereliction of professional duty. Finally, confronting the patient directly with accusations or assumptions about their medication use, without the pharmacist's involvement, could damage the patient-pharmacist relationship and lead to defensiveness, hindering any potential for positive intervention. Professionals should approach such situations by first recognizing the potential for harm and the need for intervention. The next step is to consult with the supervising pharmacist, who is trained to assess these situations and determine the appropriate course of action. This collaborative approach ensures that patient safety is paramount while adhering to legal and ethical standards of practice. Question 17. During the evaluation of a patient's medication profile, a pharmacy technician notes that the patient has a significantly reduced glomerular filtration rate, GFR, based on recent lab results. The patient is prescribed several medications that are primarily eliminated by the kidneys. What is the most appropriate action for the pharmacy technician to take? Option A. Consult with the pharmacist regarding potential dose adjustments for the renally excreted medications. Option B. Advise the patient to increase their fluid intake to help their kidneys eliminate the medications. Option C. Dispense the medications as prescribed without mentioning the reduced GFR to the pharmacist. Option D. Independently adjust the dosage of the patient's medications based on the reduced GFR. Correct answer is A. Consult with the pharmacist regarding potential dose adjustments for the renally excreted medications. Explanation. This scenario is professionally challenging because it requires the pharmacy technician to understand the implications of a patient's renal function on drug therapy, a critical aspect of patient safety and medication efficacy. The technician must recognize that impaired kidney function can lead to drug accumulation, increasing the risk of toxicity. This requires a proactive approach to ensure patient well-being and adherence to best practices in medication management. The correct approach involves consulting the pharmacist about potential dose adjustments for medications known to be renally excreted. This is the most appropriate action because the ExCPT exam emphasizes the technician's role in supporting pharmacist-led patient care. Pharmacists are licensed to make clinical judgments regarding drug therapy, including dose adjustments based on patient-specific factors like renal function. The technician's responsibility is to identify potential issues and bring them to the pharmacist's attention, thereby facilitating safe and effective medication use. This aligns with the technician's scope of practice, which includes assisting the pharmacist in patient care activities and recognizing situations that may require pharmacist intervention. An incorrect approach would be to independently adjust the medication dosage. This is a direct violation of the pharmacy technician's scope of practice and could lead to serious patient harm due to incorrect dosing. Pharmacy technicians are not authorized to make clinical decisions about medication therapy. Another incorrect approach would be to ignore the patient's reduced renal function and continue dispensing the medication as prescribed without any comment. This failure to recognize and report a potential safety concern is a significant ethical and professional lapse. It demonstrates a lack of understanding of pharmacokinetics and the importance of renal excretion in drug elimination, potentially leading to adverse drug events and patient harm. A further incorrect approach would be to simply inform the patient to drink more water. While hydration can play a role in overall health, it is not a substitute for appropriate medical management of impaired renal function and its impact on drug dosing. This approach fails to address the core issue of drug accumulation due to reduced kidney clearance and could mislead the patient into believing a simple lifestyle change will suffice, delaying necessary medical intervention. Professionals should employ a decision-making framework that prioritizes patient safety and adheres to their defined scope of practice. This involves 1. Identifying potential risks or deviations from standard care, e.g., impaired renal function affecting drug excretion. 2. Consulting with the supervising pharmacist for clinical guidance and decision-making. 3. Documenting the interaction and any actions taken. 4. Continuously seeking to expand knowledge regarding drug therapy and patient-specific factors. Question 18. Market research demonstrates a significant increase in patient inquiries regarding gastrointestinal medications. A patient presents a prescription for omeprazole 20 mg, but the prescription indicates dispense as written, and the patient states they were previously taking pantoprazole 40 mg. The pharmacy technician is tasked with optimizing the process for handling such discrepancies to ensure patient safety and efficient workflow. Which of the following approaches best addresses this situation within the ExCPT regulatory framework? Option A. Dispense omeprazole 20 mg as written on the prescription, assuming the physician made a deliberate change. Option B. Suggest the patient purchase over-the-counter omeprazole 20 mg if they believe it is a suitable replacement. Option C. Advise the patient to speak with the pharmacist about the discrepancy. Option D. Contact the prescribing physician to clarify the medication change and confirm the new prescription for omeprazole 20 mg. The correct answer is D. Contact the prescribing physician to clarify the medication change and confirm the new prescription for omeprazole 20 mg. Explanation. This scenario presents a professional challenge because it requires the pharmacy technician to balance patient care with regulatory compliance when encountering a potentially inappropriate medication request. The technician must recognize that dispensing a medication without proper prescriber authorization or a valid prescription, especially for a controlled substance or a medication requiring specific monitoring, could have serious legal and ethical ramifications. Careful judgment is required to ensure patient safety and adherence to pharmacy laws. The correct approach involves verifying the prescription with the prescribing physician. This is the most appropriate professional action because it directly addresses the discrepancy and ensures the patient receives the correct medication as intended by the prescriber. This aligns with the fundamental ethical responsibility of a pharmacy technician to ensure the accuracy and legitimacy of dispensed medications. Furthermore, it adheres to regulatory frameworks that mandate verification of prescriptions, especially when there are ambiguities or potential errors, to prevent medication errors and ensure patient safety. This process upholds the integrity of the prescription process and protects both the patient and the pharmacy from potential harm. An incorrect approach would be to dispense the medication based solely on the patient's verbal request without further verification. This fails to comply with regulations requiring a valid prescription for dispensing and bypasses the prescriber's direct authorization, potentially leading to incorrect dosing, drug interactions, or dispensing of a medication the patient should not receive. This action poses a significant risk to patient safety and violates professional standards. Another incorrect approach would be to refuse to dispense the medication and simply tell the patient to return to their doctor without offering to assist in verifying the prescription. While refusing to dispense an unverified prescription is correct, failing to offer assistance in the verification process is a missed opportunity to provide patient support and can be perceived as unhelpful. A more professional approach would involve offering to contact the prescriber on behalf of the patient to clarify the situation. A third incorrect approach would be to suggest an over-the-counter alternative without confirming the patient's condition or the appropriateness of such an alternative for their specific needs. While over-the-counter medications can be helpful, recommending them without a proper understanding of the patient's medical history or the prescriber's intent could be detrimental and constitutes practicing beyond the scope of a pharmacy technician's responsibilities, which is to assist in dispensing and verifying prescriptions, not to diagnose or recommend treatment. The professional decision-making process for similar situations should involve a systematic approach. First, identify any discrepancies or potential issues with a prescription or medication request. Second, consult relevant pharmacy policies and procedures, as well as applicable state and federal regulations. Third, communicate clearly and professionally with the patient to gather more information. Fourth, if necessary, contact the prescriber to clarify or verify the order. Finally, document all actions taken and communications thoroughly. This structured approach ensures patient safety, regulatory compliance, and ethical practice. Question 19. Process analysis reveals that a pharmacy technician observes a patient who is a regular customer and known to be taking an antidepressant and an anti-anxiety medication, exhibiting slurred speech and appearing disoriented while attempting to pick up their prescriptions. The patient also seems to be fumbling with their wallet and has difficulty focusing on the conversation. The technician is concerned about the patient's current state and potential impairment. What is the most appropriate action for the pharmacy technician to take in this situation? Option A. Ignore the behavior as it is not the technician's responsibility to assess patient impairment. Option B. Discreetly inform the pharmacist of the observed behavior and concerns. Option C. Immediately call the patient's prescribing physician to report the observed symptoms. Option D. Directly ask the patient if they are experiencing side effects from their medications or if they have taken too much. The correct answer is B. Discreetly inform the pharmacist of the observed behavior and concerns. Explanation. This scenario presents a professional challenge due to the intersection of patient privacy, potential patient harm, and the pharmacy technician's role within the regulatory framework. The pharmacy technician must balance the duty to protect patient confidentiality with the responsibility to ensure patient safety, especially when dealing with potent CNS medications that carry significant risks if misused or if the patient is experiencing adverse effects. Careful judgment is required to determine the appropriate course of action without overstepping professional boundaries or violating patient rights. The correct approach involves discreetly informing the pharmacist about the observed behavior and concerns. This upholds professional responsibility by bringing a potential safety issue to the attention of the licensed professional who is ultimately responsible for patient care and medication management. The pharmacist can then assess the situation, consult with the patient if appropriate, and take necessary actions, such as contacting the prescriber or providing patient counseling. This aligns with the ExCPT exam's focus on the pharmacy technician's role in supporting patient safety and adhering to pharmacy law and ethics, which emphasizes the importance of the technician's role as a support staff member who identifies and reports potential issues to the pharmacist. An incorrect approach would be to directly confront the patient about their medication use or perceived impairment. This oversteps the pharmacy technician's scope of practice, as direct patient counseling and assessment of medication effects are the responsibility of the pharmacist or prescriber. It could also lead to patient defensiveness, denial, or a breakdown in the patient-pharmacist relationship. Furthermore, it could violate patient privacy by discussing their medication in a manner that is not initiated by the patient or deemed necessary for dispensing. Another incorrect approach would be to ignore the observation and take no action. This fails to address a potential patient safety concern. If the patient is indeed experiencing adverse effects or misusing their medication, inaction could lead to serious harm. Pharmacy technicians have a professional and ethical obligation to report any observed issues that could impact patient well-being to the supervising pharmacist. Finally, an incorrect approach would be to immediately contact the prescriber without first consulting the pharmacist. While contacting the prescriber might eventually be necessary, the pharmacy technician's primary reporting line within the pharmacy is to the pharmacist. The pharmacist is best positioned to determine the urgency and nature of the communication with the prescriber, ensuring that all relevant information is conveyed accurately and efficiently. The professional reasoning process in such situations should involve 1. Observation of a potential issue. 2. Assessment of the potential risk to the patient. 3. Reporting the observation to the supervising pharmacist. 4. Allowing the pharmacist to take appropriate action based on their professional judgment and scope of practice. This systematic approach ensures patient safety while respecting professional roles and responsibilities. Question 20. Comparative studies suggest that when a patient asks a pharmacy technician for a detailed explanation of how their new prescription medication interacts with their body at the cellular and molecular level, what is the most appropriate and professionally responsible course of action for the technician to take? Option A. Advise the patient to research the medication's mechanism of action online to find the most comprehensive information. Option B. Politely inform the patient that this level of detail is best explained by the pharmacist and then promptly notify the pharmacist of the patient's question. Option C. Tell the patient that such information is proprietary and not available to patients. Option D. Attempt to provide a simplified explanation based on general knowledge of drug classes, acknowledging that it may not be entirely accurate. The correct answer is B. Politely inform the patient that this level of detail is best explained by the pharmacist and then promptly notify the pharmacist of the patient's question. Explanation. This scenario presents a professional challenge because a pharmacy technician is being asked to explain a complex pharmacological concept to a patient. While patient education is a crucial aspect of pharmacy practice, the scope of practice for a pharmacy technician is defined by regulations and professional guidelines. Misinterpreting or overstepping these boundaries can lead to patient harm, legal repercussions, and a breach of professional ethics. The technician must navigate the need to be helpful and informative while adhering strictly to their defined role. The correct approach involves the pharmacy technician recognizing their limitations and deferring the detailed explanation of a drug's mechanism of action to the pharmacist. This aligns with the ExCPT certification's emphasis on understanding the roles and responsibilities within the pharmacy setting. The pharmacist, as the licensed professional responsible for drug therapy management, is qualified and legally permitted to provide in-depth information about how medications work at a cellular and molecular level. This ensures the patient receives accurate, comprehensive, and appropriate information, and it upholds the regulatory framework that delineates technician duties, which typically focus on dispensing, inventory management, and assisting the pharmacist, rather than direct patient counseling on complex pharmacology. An incorrect approach would be for the pharmacy technician to attempt to explain the drug's mechanism of action themselves. This is a failure to adhere to the scope of practice as defined by the ExCPT and relevant state pharmacy laws. Technicians are not licensed to provide clinical advice or detailed pharmacological explanations. Doing so could lead to the transmission of inaccurate or incomplete information, potentially causing the patient to misunderstand their medication, leading to non-adherence, adverse effects, or a lack of therapeutic benefit. This also bypasses the pharmacist's essential role in patient education and drug therapy management, which is a regulatory and ethical requirement. Another incorrect approach would be to dismiss the patient's question entirely without offering any assistance or redirection. While the technician cannot provide the explanation, ignoring a patient's inquiry is unprofessional and detrimental to patient care. It fails to uphold the principle of patient-centered care and can erode patient trust in the pharmacy team. The professional decision-making process in such situations should involve 1. Identifying the patient's request and assessing its complexity. 2. Recognizing the boundaries of one's own professional scope of practice as a certified pharmacy technician. 3. If the request falls outside the technician's scope, politely and professionally informing the patient that this information is best provided by the pharmacist. 4. Promptly notifying the pharmacist of the patient's question and the need for their expertise. 5. Assisting the pharmacist in any way possible to facilitate the patient's understanding, such as retrieving the medication or relevant patient information.